I'm going to go ahead and ask the secretary to call the roll.
Senator Rocky Adams, Senator Alvarado,
Here.
Senator Berg, Representative Bentley,
Here.
Representative Herron,
Here.
Representative Mosier, Co-Chair Meredith,
Present.
Co-Chair Meade.
Here. Quorum is established, and with that, I will entertain a motion to approve the minutes from the last meeting.
So moved.
Motion and second to approve the meeting. All those in favor, please signify by saying aye. Aye. All opposed, nay. Motion carries and the minutes are adopted. We're going to go ahead and jump right into it. We've got quite a bit on the agenda today, so we will go ahead with the Department of Aging and Independent Living. And Secretary, Commissioner, you may go right on ahead, introduce yourselves for the record, and proceed at any time.
Thank you, sir. Thank you, Chairman. Eric Friedlander, Secretary of the Cabinet for Health and Family Services.
Victoria Elridge, Commissioner for the Department for Aging and Independent Living.
Layla Williams, Deputy Commissioner for the Department for Aging and Independent Living.
And I want to state for the record that I have never been over this program or any of the programs within the Department for Aging and Independent Living. So here's one. What I want to say, and I'll turn this over to Commissioner Elridge really quickly. There was a lot of adaptation that had to happen. Senior meals had to be adapted for the last couple of years. We really changed some of the funding pieces around guardianship, actually started in the previous administration, a real focus on food and nutrition, as well as some, I think, good changes within some of the state-funded programs, and Commissioner will talk about that some. Those are those programs like personal care assistant program, heart-supported living. You'll hear some, you probably already heard some about that. But those are straight general fund programs as opposed to Medicaid programs that serve folks who are elderly or disabled. And so with that, I'm going to be very quick and turn it over to Commissioner Elridge.
Thank you all very much. It's an honor to be here in front of you all, and look forward to educating you all in the Department for Aging and Independent Living. So our mission is simple. It is to promote the welfare, dignity, and independence of older adults, individuals with physical disabilities, and adults in need of a guardian. Kentucky has over 1 million individuals aged 60 and older. The Secretary keeps no secret that he falls into that, as do many other individuals. Our department is here to support all of those individuals that have disabilities, and their caregivers, because we know without caregiving, without family support, without community support, individuals would not be where they are at today. So what does Kentucky look like in supporting older adults and individuals with disabilities? Based on the latest data, we know that individuals aged 55 and older is expected to nearly double by 2040, which we know is less than 20 years away, and really appreciate the work that has gone on over the past 4 years to support older adults. We know that, again, there's over 1 million aging individuals in Kentucky, and that number is expected to grow. We are one of the fastest aging states in the country, and the work that we do here will set precedent nationally for how we ensure that older individuals have their rights met in the community of their choice. We also know, as the Secretary spoke about, that 1 in 7 Kentuckians experience food insecurity. For older adults, that number is specifically heightened. And so through Governor Beshear's budget and also the legislative approved budget, there is an additional $35 million that was put into the fiscal year 22, and then 23 and 24 to ensure that older adults remain food secure. That is information and data that we have been touted, and Kentucky has been recognized nationally to ensure that our seniors remain food secure, and we have also eliminated the wait list for seniors, and we'll talk more on that next time later on in the presentation. And then lastly, just want to keep in mind, as we talk about an aging state, that as of now, 23% on a statewide level of Kentuckians are 60 and older. We do know in our rural areas that number is anywhere between 28 to 30%. You think of Monroe County, you think of Trigg County. Those counties have a high aging population with very limited social services available to them. mainly in part, it is their local senior center that provides those services, and we are honored to serve those individuals. So what other populations do we serve? As I've spoken to, we serve older adults, individuals with disabilities. That goes for the entire age gamut. We serve individuals with dementia and also adults under guardianship. There are 4,500 individuals under guardianship that are court appointed to us when the individual has no other family member or community person that is able to willing and step up and befriend them to oversee their medical decision making or their financial decision making. And then lastly, again, we support caregivers. We all know that without caregivers, we would not be where we are at. We all, at some point in time, have had supportive caregivers, whether it's our parents, our pastors in our community, our next door neighbors, and anyone in between. Within our department, we are either federally funded or state funded. There are an array of federally funded programs through the Older Americans Act. It is the Long-Term Care Ombudsman program. That program is, again, part of the Older Americans Act and ensures that individuals in long-term care have a say and have a voice that is unobstructed through long-term care or through family members. We also, as we had spoke to earlier, have congregate and home-delivered meals. When we talk congregate, those are meals that are provided in your local senior centers. There are 195 senior centers across Kentucky. There is at least one in every 120 counties. And then the home-delivered meals, there are individuals who are not able to get out of their home, and we ensure that their nutritional needs are met. Additionally to that, if individuals participate in senior centers, they have opportunities to participate in health promotion and disease prevention. I was recently at the Callaway County Senior Center out in Murray, Kentucky. They have a phenomenal program out there. I know a lot of you all have heard about pickleball. Pickleball is a hot commodity out there. It is a wonderful program. Also, we have our Senior Community Service Employment Program. This allows individuals that are age 60 and older an opportunity to get back into the workforce in the event they have retired or had a medical need come up that has prevented them from getting back into the workforce. We ensure that they are able to return. We have the supportive services. This is ensuring that our seniors are able to stay in their home through home modifications, through lawn care, for example, if their roof needs to be repaired, if there's a hole in their floor. It's as simple as we have invested a lot of money in meals. We have to ensure that for seniors to receive those meals, that their home is secure and they are living in a stable home. Additionally, through the Older Americans Act, we provide state health insurance assistance program. This is a prescription savings program offered to older adults to ensure that their prescription plan provides the highest cost savings. And last year, through open enrollment, we hit the highest number in cost savings that we've ever hit before, thanks to, in part, the staff with the Department for Aging and Independent Living, and also in partnership with Public Health. And then lastly, there is the National Family Caregiver Program. We know that dementia is on the rise, and through the Older Americans Act, we recognize that adult children supporting their parents with dementia need additional assistance, need help. And that's what this program is geared to do. In addition to, many of you all have heard about the Grandparents Raising Grandchildren program. This is a federal program to ensure that grandparents have funding available to them to support their grandchildren when they are court appointed to take over. There's an array of state general funded programs that are overseen within our department, state guardianship, as I mentioned earlier. We also have 2 state general funded programs that support individuals with brain injury. We have the Traumatic Brain Injury Trust Fund, as well as the behavioral program. The behavioral program is a program that we are working on increasing its outreach and services to serve as a short-term crisis intervention program through some of the CMHCs. We currently do assisted living certification in the social model for assisted living. There are about 120 assisted living communities across the state. There is an increase in assisted living communities out in Western Kentucky. And we are starting to see there is an increase in older adults moving to Western Kentucky. As the Secretary spoke to earlier, we have the Personal Care Attendant Program. It ensures that individuals with severe physical disabilities, meaning the functional loss of 2 or more limbs, you think of someone who's had a spinal cord injury, they would be able to access this program to ensure that they're able to live independently. We have the Heart Supported Living Program. It's a program, honestly, that is near and dear to my heart. It is a program of last resort to ensure that individuals are able to receive their therapy services or receive adaptive equipment. A great example is we were able to fund a 3-year-old who all this individual wanted to do was to ride a tricycle. That is all he wanted to do to go along with his family on bike rides. He needed an adaptive tricycle because of his cerebral palsy. And so we were able to fund that after his family didn't have the financial means and they had maxed out all of their insurance. The home care program mimics the supportive services program through the Older Americans Act and ensures that older adults are able to stay in their home through home modifications. And lastly, the family caregiver program. This program is specific solely to grandparents supporting their grandchildren in their community. This is a program that I know could has had great use, and we are working closely with Friskies to ensure the use moving forward. So those are the different programs that we directly either oversee or through contract with our community partners. There are some administrative oversight and support entities that we oversee. One is the Medicaid Home and Community-Based Waiver. As we are the Department for Aging and Independent Living, it's only right that we oversee this waiver. It is to support aging individuals and individuals with disabilities. It has the highest enrollment rate of all 6 waivers at about 14,000 members. In addition to that, we also oversee all participant-directed services for all Medicaid waivers. There are 6 Medicaid waivers. 5 of the 6 offer a PDS option. And then also we oversee the State Independent Living Council. There are various centers for independent living across the state to support individuals with disabilities. There is a council that we oversee to ensure the Centers for Independent Living voice and the participants that they serve, that their voices are being heard. We do have the Alzheimer's Disease and Related Dementias Council. This council was revitalized through legislation in 2021. It was expanded to include more researchers, to include a wider community base, and is overseen through our Office of Dementia Services. And then also there is the Elder Abuse Council. I have the distinct honor to co-chair that council along with Dr. Keith Knapp. It is a statewide council that works with various other cabinets to ensure that older adults that they prevent elder abuse through community partners such as state police, such as long-term care associations are also part of that as well. And then lastly, brand new to us is the Program for All-Inclusive Care for the Elderly. This is a PACE program that we just started in September of this year, enrolled our first participant, and it is a partnership between our department and the Department for Medicaid Services. Right now we cover 19 counties and in process of enrolling providers to cover the other 101. So as you can see through all of that, there is a lot of work that is done. This slide is very important and really truly shows where we are. You'll see in fiscal year 2020, our department was heavily reliant on state funds to the tune of, you could honestly say, a 70-30 for state funds. Throughout the next 4 years, there was a significant transition in which we have become much more solely reliant on federal funding than state funding. The red line here shows the growth of Kentucky's aging population, and you'll see that is continuing to go up. Again, remembering that we're expected to peak in 2040. So this is really showing, one, the growth of the financial investment that as a legislature you all have made to Kentucky seniors, but also that we are shifting and relying much more on those federal funds to ensure we protect those state dollars. The This is a breakdown of our current operating budget for the current fiscal year and for next fiscal year. You'll notice that we have stayed at about $118 million. I will share with you all, prior to me being appointed in this role, our state budget was around $70 million. So we have been able to pull down additional federal funds through a Medicaid match to support state guardianship, in addition to federal grants that we have gone after to support individuals to live independently in their community. You will notice there is some money set aside that is restricted. Those monies go specifically to support the Traumatic Brain Injury Trust Fund and part of the Heart Supported Living Trust Fund. If you think about handicap parking spots and who gets ticketed, that money that you pay that ticket for goes towards the Heart Supported Living program. So what does our department look like? In order to move forward and meet our mission and our vision, how does this happen? I have the distinct honor to work alongside over 250 Kentuckians to ensure that we are meeting the needs of the state. You will notice, specifically within the Division of Guardianship, that number has increased due to the Medicaid match. We've been able to bring on additional individuals. And Senator Meredith, I had the honor of testifying in front of you last year on guardianship and the modernization that we have done, and it has been very successful. And you'll also notice for the Division of Finance and Administration, 67 staff, 85% of those staff members are specifically to support the fiduciary and benefits of the 4,500 guardianship individuals. If you think of the mail that you receive, your taxes, your health care benefits, paying any bills, our staff manage all of that for 4,500 individuals, and the other 130 oversee the medical decisions and any other decisions that need to be made out in the field. We do have 6 staff members in the commissioner's office. We have 49 additional staff that support the quality living, support aging and physical disabilities. And then also we have our newly minted Office of Dementia Services. We have 1 director there, and I am proud to say that office has been a true success, and it will turn 1 year old on October 1st. So with all that being said, what were the accomplishments through 2021? You think about, where we were with the pandemic, with how things were moving forward. One of the things, in just a true top honor, is in the beginning of January of 2021, Kentucky was one of the first states to ensure that homebound individuals had access to a COVID vaccine if they wanted it. We implemented the Shot of Hope at Home through a partnership with our department and the Department of Public Health. It is a true honor to ensure that vulnerable individuals were able to get back into the community because of this support and collaboration. We also have received national and regional recognition for working with Health Occupation Students of America. These are high school students that want to go into the healthcare field, and we were able to partner them with our senior centers through a private-public partnership with a local bank out in Western Kentucky. So that way high school students were able to make phone calls, provide social support to individuals who may be vulnerable and have experienced social isolation, and were able to connect with them. Deputy Commissioner Layla Williams conducted the 2nd annual Senior Hunger Summit virtually. We will have a 3rd Senior Hunger Summit on November 2nd of this year. It has been very well received with national attendance, and we also have had national speakers as well and have been recognized for the work that's done there. Speaking of work out in the community, through 2021, we were able to enroll the highest number of individuals through the Participant-Directed Services Program in Medicaid in history. Part of that was due to Appendix K and alleviating some of those waivers. What we do know for certain is that individuals with disabilities want the choice to direct their own care. They want to say when someone comes into their home to assist them with getting ready, or to assist them with taking them out to a job or out to a bar or what have you, wherever they want to go. What we all know is that we all want that choice. And then lastly, as I share with you all, we were able to eliminate waitlists for senior meal services. There were over 2,000 individuals aged 60 and older that were waiting for food 2,000 Kentuckians aged 60 and older who were waiting to be provided food. We were able to do that through Governor Beshear's declaration on March 13th of 2020. We were one of the only states to do this and continue to do this through the additional funding. That means more than you all will ever know to the seniors that I have met with, than knowing that they have food security through their local senior center and through various community partnerships. So our goals for 2022, what have we done this year and where are we headed? As I shared with you, we were able to establish and implement the PACE program. These were goals that I had the honor of sharing with you all in February of 2022 when I had provided the budget testimony. Those that have check marks are all goals that have been implemented as of today. We were able to develop and implement a state plan on aging dashboard to track our goal progress. Our department operates in the spirit of transparency. If we are going to invest in a 4-year state plan, we are going to ensure we are transparent as to where we are in meeting those goals. We were able to partner with the Kentucky Department of Veterans Affairs to support caregivers of veterans. And our department was recognized at the Veterans Affairs Conference last month for the outstanding partnership that we have been able to provide veterans. We are grateful for veterans and their service. We are especially grateful to support the caregivers that support our veterans. And then lastly, we were able to fully implement all guardianship modernization positions and training. We've seen a decrease in turnover in guardianship, in addition to additional money coming into to lower caseloads for state guardianship staff. You'll notice the one area that doesn't have a check mark is a grant program called REAP. It stands for Remove, Reduce, Educate, Adjust, Accommodate, and PACE. It's a concussion management program aimed in schools. We all know about sports injuries in schools. We are all aware of how concussions can be really that hidden pandemic, if you will. And again, there's a lot of focus on sports, but what about a child that doesn't play sports who may have been riding a bike and had a bike accident and has a concussion? What REAP does is it allows schools and educators to be educated on how to assist individuals to ensure that they are successful as they are healing through a concussion. So I just received the booklet, the training material that our staff have developed through a nationally accredited program, and it will be launched next month in partnership with the Cabinet for Education and Workforce. With that, I know that was a lot of information. Just want to say thank you all for your time, for your support. And if you all need any information, our website is here, as well as my email and office phone number. Thank you.
Well, thank you for the presentation. At this time, I'm going to open it up to questions. Do we have members of questions? Representative Meredith, or Senator Meredith, I'm sorry. I promoted him.
That's the other guy. He's taller, younger, better looking, smarter. But I understand the confusion. First, I want to thank you for your presentation. Excellent job, you really have. And just want to make sure that you understand that the purpose of this task force is not to criticize anyone's work. You've done exceptional work. There's no doubt about that. But I think we're really trying to identify opportunities to increase efficiencies, make sure there's no redundancy, but also make sure there's accountability for the programs that we have in place. And what becomes everybody's responsibility becomes nobody's responsibility. So that's one of the things I particularly focus on. But glad to see the work that you've done. I know there's going to be several questions here, but I'd like to start with the guardianship programs because
Yes,
that's
sir.
just something that, again, we have talked about
Yes.
previously. And I appreciate that you're undertaking this modernization program. But what's the average caseload now for state guardianship workers? Do you have that number?
I do. It varies right now in between 40 to 70. So we've been able to drop it down. The national recommendation is 40.
40.
And that is what we are aiming towards. I believe when I had testified in front of you before, we had some staff that were carrying anywhere between 80 to 100. So that number has gone down. We are on the last of hiring the last few positions that we've been able to fund through the 50-50 match. In addition to that, the quality of work has increased. We've been able to hire additional positions. I think I'd spoke to the property and asset management positions. They are able to manage all of the properties and all of the vehicles, all of the other items that individuals may have, as well as we have implemented guardianship floaters, if you will. I'm an occupational therapist. I come from a medical background, and float staff are invaluable to ensure individuals have time off. With our guardianship, we know it is a 24/7 business. We all know that crises happen between 5 p.m. and 8 a.m. And so our float staff are able to assist our guardianship staff with that and give them time off, as well as they can take time off without having to add their caseload onto another guardianship worker that float staff steps in to alleviate that and allow them to truly take time off.
Good. I appreciate that. And I guess this next question is directed towards that potential redundancy. Do you have any idea how many guardianship cases have some type of history with adult protective services?
I have that data for you. I cannot tell you for certain, but I can get that to you as soon as we're done.
Okay.
So there is, we do have great collaboration with APS and guardianship. And we are able to ensure that before APS submits the case over to us, that it is well vetted to ensure we are truly the program of last resort and that there is no other outstanding family available to take on this individual.
Well, I guess hand in hand with that is also some of the waiver programs, like a brain injury. I imagine there's some overlap there. So can you
Yes.
give me some statistics on that as well?
Absolutely. I can share with you the SCL waiver does support guardianship individuals. There's about 1,600 individuals with developmental or intellectual disabilities that are also under state guardianship that are enrolled in the SCL waiver.
Oh, okay. Thank you, Mr. Chair.
Senator Alvarado.
Thank you, Mr. Chairman. Appreciate it. Just a couple quick questions. I mean, I know I was going through a lot of the things you guys have oversight over. One of them I noticed is long-term care, kind of ombudsman program, which is a program I've had problems with. I don't have a lot of confidence in particularly one, but it's the Nursing Home Ombudsman Agency. And so my question is, how does the role of the long-term care ombudsman program differ from that as a function of adult protective services or the Inspector General or even the CHFS kind of ombudsman office that they have it as? How is that different for you all?
That's a great question, Senator. Thank you for that. So the ombudsman works directly with the individual. They go out to the facility to ensure that the individual, say there's the complaint that a call light is not being answered, it's been over an hour. And so the resident makes that concern to their family member. The family member reaches out to the ombudsman agency. It is a direct line to that individual. There is no one in between. The ombudsman goes out and sits with that individual. The majority, actually, of the calls that come into the ombudsman are around call lights. There's also long-term care staff that have a direct line to the ombudsman if their needs aren't being met as well. So whereas with OIG, it's an investigation under their view. With the ombudsman, they have to respond within a certain period of time to that individual to ensure that their voice is being met. And the ombudsman truly serves as a mediator between the individual and the facility.
Yeah, I don't know if that's what happens that's what's supposed to happen. That isn't what happens in real practice. I mean, I do nothing but long-term care. There's a lot of gotcha stuff from the ombudsman agency, from the people that they train. When there's been problems, I've reached out, and it's more of a, what do you want us to do about it kind of thing. When I ask what can be done about the ombudsman agency, when I've contacted members within our own cabinet, they say nothing. It's federally required. It's a federal program. We're just a pass-through. So I know we have oversight, but there is really no oversight over the ombudsman programs. That's why I'm wondering, is it any different from what OIG does, what it's from the CHFS's ombudsman office, all that's just different, if it's a different thing, because I don't know that we provide any oversight. It's there, it's structured, money comes from the federal government, gets passed through, but if they don't do a good job, if they're not following their proper policies, how do we file a complaint for those who are overseeing? It's got to go through Congress, is my understanding, and most of the time they just set that up and said, here, they can handle the issues that we get called about. We don't want anything done. And it's an organization that claims to be understaffed and claims that they want more responsibility. So when we had an assisted living bill, we want oversight over that too, even though we don't have enough personnel to handle our current long-term issues, which is a concern for me. So when they don't have enough staff, but they're asking for more work and then complain that they don't have enough staff to handle the work and are asking for more work, it just doesn't make any sense. So I'm just curious in terms of that. A couple other questions if I can, Mr. Chairman. So I was looking through a lot of the different programs you've got here. How does your department promote health and disease prevention differently than the Department for Public Health?
So we actually serve as a collaboration within that. Under the federal program, we have to provide evidence-based education, and the programs that were provided are geared towards 60 and older. One of the programs that has actually been very successful has been it's a program called Bingo Size. It implements exercise and bingo together. And it was actually founded in Western Kentucky through Western Kentucky University and is a worldwide renowned program. Specific to that, that is a program that is through the Older Americans Act and has to be overseen by the State Unit on Aging Director, which is the individual that is assigned to oversee all Older Americans Act programs. Federally, it does not allow for delineation of, Title 3D, which is the Health, Disease, and Prevention program, cannot be separated out to public health, whereas this, title program can be moved here and so forth. They all have to be housed together.
So it couldn't be under the Department of Public Health? I mean, under a different, you're saying this federally was not allowed?
Correct.
Okay. Also noticed that your department administers a state health insurance assistance program.
Mm-hmm.
So how is this program different from the role of connectors, assisters within the health benefit exchange? Could this program be incorporated and operationalized by the health benefit exchange?
That's a great question. This program specifically that we operate is another one that is through the Older Americans Act. It is through to ensure that older adults have a direct line to review in part through the Older Americans Act. But it is a direct line to ensure that older adults have a direct line to review their prescriptions. So it is one in which we contract with the Department for Public Health because we have access to and we support so many individuals that are aging and that we know we have that expertise. We're also able to connect them with, no pun intended, with older adult services to support them through social services, such as the home repair and home modification.
I want to add just a second to that. So public health, right? That's a prescription drug assistance program. Mm-hmm. So just want to make sure you all know that that's the tie into public health. And two is whenever I have somebody, so this is a constituent issue, right? Whenever I have somebody that has questions about Medicare and those kinds of things, I refer them to a SHIPS line in aging and independent living. Mm-hmm. Because Medicare is complicated and what those coordinations of benefits pieces are, and actually I wouldn't refer them to a connector. I refer them to Dale.
Could they be operationalized though? Could they be absorbed?
It's so specific. I'd worry about it because Medicare is all those rules can get really. They have their own set of rules, and it just I would worry about moshing it together with connectors, but it does come, again, it's a federal funding issue as well, but it's also then a really training and really specific program around really how you maximize your Medicare and your prescription direct benefit.
And Senator, if I may propose that if we were to flip that and ensure that our SHIP directors and our SHIP staff, they could be trained to be connectors as well. There are many adult children that call on behalf of their loved one and trying to figure out what does Medicare mean for mom. And we could also, if they're speaking with a connector that's also SHIP trained, ensure that, hey, while I have you on the phone, do you have insurance? Do you have the benefits you need for yourself?
One more question, Mr. Chairman, if I could. Also, I know we've heard testimony about a lot of our Medicaid waivers that are administered through the cabinet. We've heard testimony from the Secretary, from DMS also, that all of them went through there. But here you've got also, again, two of the waivers, which are the Heart-Supported Living Program and the Brain Injury Waiver and Trust Fund. Is it necessary for these programs to be in your department, or should they be directly issued by Medicaid or the Department of Behavioral Health and Intellectual Disabilities? Would it be put under there? Because a lot of the other waivers are handled through that. So that's what I've another curiosity there, too.
So just just for clarification, the programs, the heart supported living and brain injury, those are state-funded programs. They're not Medicaid waiver programs. There are some similarities to brain injury. The Brain Injury Trust Fund is in addition to the waiver. So if there are certain items that an individual isn't meeting under the brain injury waiver, they could meet through the Brain Injury Trust Fund. Same with the heart. If they have maximized out all of their waiver services, they could do that. So there would be that, there is that similar service, yes. There are individuals that we provide that receive both, yes.
There are 4 brain injury programs when you think about it. There are 2 in Medicaid. There's the acute brain injury waiver and the long-term brain injury waiver. And then in Dale, you have 2 state-funded brain injury programs, the regular TBI program and the behavioral. And so they can work together and often work together, but there are like 4 separate programs depending upon where somebody is in the length of the onset of the traumatic brain injury, as well as then there's some things that Medicaid can't pay for that you can get, or somebody maybe is not eligible, more rare, but that the state-funded programs can pay for, that the traumatic brain injury fund, that the state funds can pay for when Medicaid can't. And it is that kind of age-old question that when we were talking about Medicaid, where do you, the programmatic expertise I feel like is in Dale, the fiscal expertise is in Medicaid, and so that's why you see some of the division of who's overseeing the waiver program from a programmatic perspective, and then who is overseeing a waiver program from a fiscal perspective. I will tell you, different cabinet secretaries, it's gone back and forth where Medicaid's running it all to where like Dale is running it all, or they move the Dale person into Medicaid. There have been all sorts of configurations. I can't tell you what's right. Each one has a strength and a weakness. My preference is to have the programmatic folks working on the programmatic side, and Medicaid, who should have the fiscal responsibility, working on that. That's the philosophy I'm working under. Like I say, it is. I've seen every configuration.
Just trying to identify efficiencies is what we're trying to do.
Right.
You know, taking a look if we're going to restructure things. Is okay. Are there things that are being covered here that it has overlap? I mean, would it be easier to create those? I appreciate your answers. Thank you, Mr. Chairman.
I believe Senator Meredith has a follow-up here.
Just a brief one. It's, I guess, goes back to philosophy, and you and I talked about this a little bit. Is I would really like to see the presence of the Department of Public Health be elevated. I think their importance really has been emphasized during this COVID situation. But one of the things we've had a lot of discussions about, particularly Senator Alvarado and I, is who's responsible for the health of the state. And I think we've kind of delegated that to the MCOs, and they haven't done a very good job. So I would hope that we'd have one central agency that we can say, you're going to improve the health of the state, and we're going to hold you accountable for it. But I see programs such as this concussion management program implementation, great program, but should that be a public health function?
So to that, I can share with you specifically, we do have representatives of public health on that. Whether a program is housed within a certain department or not, there are Dale representatives that are engaged in public health programs. There are public health representatives engaged in Dale programs. You know, core to the mission is what is the mission and what do we need to do to that. Whether it's housed in one or the other, we know that it takes a collaborative approach to move something forward.
I agree with the collaborative approach, but again, it divides the ultimate responsibility is who's accountable.
Right.
And again, if we're going to truly improve the health of the population, who's going to be responsible for that? So, again, philosophical discussion. Thank you. Thank you, Mr. Chair.
Representative Mosier.
Thank you, Mr. Chair, and thank you very much for this presentation. I know it's big and it's hard to explain to those of us who aren't living in this every single day.
It's an honor to do so.
And I think we've touched on this, but have you been able to identify any gaps in coverage for individuals with these separations of programming and financial responsibilities. It seems to me that I heard about an issue, and maybe this is not specific to Dale, but coverage for behavioral issues versus psychiatric issues. And I just use that as an example of, there's a breakdown in coverage. Have you seen that?
That is a great question, Representative. If I were able to speak to it, it would be within guardianship with regard specific to those coverage areas. The one thing that I can share with you is that we have a great team at Dale, and we have really expanded our ability to collaborate with MCOs. Actually had an opportunity to meet with a Medicare provider as well, but really looking to see what community options are out there and ensure that our staff are as knowledgeable as possible to ensure that there are not there's gaps, and that if there are, we know who to contact. Through the Secretary's leadership, he has really ensured that there are no barriers, there are no silos between our departments, and that our staff are able to call and contact if there is a need there. Specific to supporting individuals such as serious mental illness, that is the majority of the individuals that are served in guardianship. If there are coverage gaps, we make it known and work towards addressing that, such as the concussion program, if you will, specifically. Even to that, specific to our guardianship individuals, if we were to close that gap, that doesn't necessarily, there's a chance that it could be successful. There's also a chance it might not be.
I would add some of those gaps have to do with available trained healthcare personnel, gerontology, psychiatric. There's just not a lot of folks that provide and are trained in that. There are centers at U of L and UK. I don't know if there's really anyone else that you'd point out, but it's not statewide, and it is a need that is growing and will be growing. The other piece that I think, and I said this I think my first day of testimony, the other challenge is housing, right? If we end up, and we do, right? Medicaid pays for 70% of our nursing facility residents who are in larger facilities. Our waiver programs are the only programs that pay for smaller site housing, and that's it. And so I think we do. Challenges in housing are there. Certainly, there's some more assisted living opening up in Western Kentucky. They're expensive. If you're fortunate enough to have long-term care insurance, that can help. But I think that's a real challenge to us to get that kind of coverage. The other place where we hear about, I don't know if it's gaps, but frustrations, sometimes from hospitals who are looking for individuals where they don't have a placement, and they don't have somebody who can make decision because somebody maybe doesn't have decision-making capabilities at that point. How do we, and we've had some discussions with KHA, but how do we do that without overburdening our system, right? But then how do we work with the providers when there's somebody who doesn't have decisional capacity, and what's that process? Because it's a court process and it takes a while. And I know that's a frustration in the provider community as well. Those are the major ones I think of.
I will just add to that, as the Secretary was talking, able to take a minute. There is a revolving door, if you will, with our corrections facilities, with individuals with serious mental illness being released back out to the street before a private or public guardian is notified, and then they have gone AWOL. We are notified back when they are in the hospital after they've been assaulted or what have you. So
I think that, and Secretary Harvey would tell you that he has folks who are in correctional facilities who are aging, no longer a threat, right? They're probably getting close to end of life. How we work with those populations is a challenge, and we don't have great locations, right? If you're a nursing facility, you don't necessarily want to, and this is, I mean, it's legitimate. I'm not criticizing anybody, but if you're a nursing facility and you have somebody that has a criminal background, you're not going to necessarily welcome them in, right? So they have challenges as well in terms of thinking about placement. So those are all challenges within, I think, and gaps, but challenges within that kind of side of the system, particularly when it comes to folks who are aging.
May I follow up, please? So thank you for bringing up the housing issue and certainly the older aging population in jail. And are there areas where you think this population would be better served in the Department of Justice, or I mean, it's all still a healthcare issue, and so housing becomes really challenging. And I don't want to underestimate your ability to handle this, but it seems that we need some strong partnerships in these areas. Is
And
that happening?
It is. We're beginning that work. This has been an issue, I think, for 20 years, as far as I know. So we've begun some discussions. There are no easy answers. We're still waiting, for instance, on our 1115 waiver about substance use and folks coming out of facilities and whether CMS will approve that kind of transition time.
Right.
I was at a conference last week, and the CMS folks said, well, yes, they're really, really, really thinking about it now. So I'm slightly hopeful, but it's been 2 years since we've had that waiver in. So that piece, and it's the funding piece that I think is really tricky.
Mm-hmm. Yeah, I had those same conversations last week at a Medicaid conference. So, all right, thank you.
Representative Herron.
Thank you. I have two questions. One is just a clarifying question. On slide 5, you talked about the grandparents program.
Yes.
Is that program just for youth with disabilities, or is it all of the young people that need that care from their grandparents?
It is open to anyone. Federally, there is an age requirement. At the state level, we have removed that age requirement. We recognize that individuals become grandparents at any age, and that if they have court custody they have custody of their grandchild, it's inclusive of all individuals. So all abilities, all children.
Okay, thank you. I have one more question. And the other question, with the increase, or we know that we're going to have a large number of Kentuckians aging, has there been any type of projections about the workforce and employment and what we need to be doing to prepare to care for this population in the years to come? And if so, what does that look like, and how are we partnering with our education folks to make sure that we have that base?
That is a great question. So a perfect example of that is the partnership that we are doing with the Health Occupation Students of America. We are working with high schools, so working with high school students. I know a lot of my peers in other states are working at the college level, which is great, but we also know a lot of individuals at the high school level are deciding where they want to go. So we are starting early on and ensuring that individuals are familiar with aging, and that it is a very honorable profession. There is no better job than to give back to people that have come and served their time. So we are working with high school students that are interested in going into the healthcare field. We have a partnership right now with the University of Kentucky and in offering up through virtual classes a mentorship program to educate them on what the programs that we offer. In addition to that, work with the Secretary's office through a certified nursing CNA program to ensure that we are getting more CNAs in. And then also, in addition to that, through our Office of Dementia Services, we are just starting early on to look at geriatricians. We know that pediatrics is a great field, and I was a pediatric occupational therapist. Love working with kids. And again, it's needing that love and that compassion for our older adults. I have worked in both fields. It's a true honor. And so it is making sure that college students and high school students understand geriatrics and want to have that drive to be able to give back, especially to geriatric psychology.
Can I have a follow-up, please? Like a specific number of how many people we're going to need to help this population in the workforce?
Yes, we can work and look to see what we have within the cabinet. I'm sure that we have that, and if not, we can work with the Cabinet of Education and Workforce to get that to you. But we can definitely do that.
Okay, thank you.
Thank you.
Thank you for our work.
Thank you.
Do any other members have any questions? Senator Meredith.
Just a brief one. First, congratulations on your success with eliminating the wait list for senior meal services. That's wonderful. But just curious, that's one of those programs why isn't that under DCBS?
To provide meals to seniors.
Yes.
So that program is another one. It falls into the Older Americans Act. So it's the State Unit on Aging was allocated when the Department for Aging and Independent Living was established. Our department was actually a branch under DCBS, and it was developed as its own separate standalone department. Meals specifically, as we know, are delivered in the home to individuals and along with the supportive services. So it's ensuring that we have that full, separate, independent living department to support older adults.
I was there when they started the Department for Independent Living, even though I was not over it. And it was that under DCBS, the focus was really APS. So it was more of a, not enforcement, but the Adult Protective Services, it was more on protection. It was more on that side of the house. And it was decided at that point in time to move it to give that focus on aging, right, and disabilities primarily. There was nobody that had that singular focus. The disabilities piece actually came out of behavioral health. So they kind of merged two pieces together to make aging and independent living. So that it's an explanation of why it came to be and where it is. And as the recipient of the aging funds, right, that's why these programs cluster in this department.
Well, good answer, but I'm concerned about this Pontius Pilate thing you keep doing. I wouldn't respond.
I have one follow-up question to that. You mentioned a couple of times that it's mandated by the federal government. Is the programs mandated or is the department mandated? Because there's a big difference there.
So it is the federal rule states for the Older Americans Act that each state should have a state unit on aging director, one person that oversees the programs, and then it's all of the federal programs. So yes, Representative Meade, you could move all of this to DCBS, to public health, yes, but you cannot split off the various programs. They all have to fall in succinct to one another. And the one thing that we know are that aging individuals are also individuals with disabilities, and that we have seen great success within our department as it has grown for it to be all housed together.
Thank you. The reason we ask these questions is because over the past couple of months, as we've heard this testimony, from the outside looking in, there appears to be a lot of redundancy in some of these things. And so as we look at it, as Senator Meredith mentioned, could some of these things fall under DCBS? Could some fall under the Department for Public Health? In several of the programs, as I look through the slides, said in collaboration with, say, Medicaid or another department. So that makes us wonder, can those fall directly under those departments then, if that's the case? So that's why we ask some of these questions, and that's the purpose of this task force, is to look at streamlining the agencies and combining some of these programs and making the departments more efficient as we move forward. So we appreciate your all's testimony and appreciate your answers. Thank you all.
Thank you.
And at this time, I guess we'll keep moving on with the Department for Income Support. And as you approach the stand there, if you don't care, just to give your name for the record, and you may proceed.
There you go.
My name is Steve Vino. I'm Commissioner of the Department for Income Support.
Good afternoon. My name is Stacy Kane, and I'm the Deputy Commissioner for the Department for Income Support.
And unlike the previous department, I was over this for a little bit. Also, Steve and Stacy have a depth of experience. Steve has been over this department before. He actually was over this group when it was actually with DCBS, particularly the child support enforcement side, and has a lot of experience working with county attorneys, and that's why I'm glad he's here. So I don't have to necessarily, they're a complex group, as you all know, and Steve has worked with them so long, I think there's a level of trust that's built there. Stacy has really worked her way up through the ranks of Disability Determination Office, and has been over than this office previously. And I will tell you that the folks at Social Security Administration have a tremendous amount of respect for her. So I felt very fortunate when they agreed to come and work with us this time within the cabinet. So with that, and trying to inflate your all's egos, we'll turn it over to you all.
Thank you, Mr. Secretary. Thank you, Chairmen Meredith and Mead. Good afternoon. There we go. Who are we? The Department for Income Support administers the Child Support Enforcement Program and the Disability Determination Services Program. Our mission in the department is to ensure vital income supports are provided to enhance the well-being of Kentucky's families. Child Support Enforcement's mission, to ensure Kentucky's children are financially supported by both parents. And Disability Determination Services mission, to determine the medical eligibility for residents of the Commonwealth who apply for Social Security and Social Security income, SSI, disability benefits from the federal government. This is a breakdown of our budget for disability. They compose 41% of the total department budget at nearly $54 million. And for child support, composes 59% of the total overall budget, or at $77.5 million of the pie, so to speak. Disability, so let's take a look at disability determination services. So they review medical claims and completes medical evaluation to determine eligibility for Social Security disability. They are 100% federally funded by the Social Security Administration. This is a little bit different than most agencies. So in disability, Social Security basically has us develop a spending plan each year, and they adjust that monthly, and they pay the bills directly. So the legislature does, obviously, through our state constitution, have to authorize the expenditure of any dollar, whether it's state or federal. So in federal fiscal year, and both programs run off federal fiscal years. So in disability for federal fiscal year, DDS closed roughly 281 full-time equivalent staff, and we're continually hiring. If you have anybody that has a bachelor's degree, we'd be interested in talking to them. We were blessed that the Social Security Administration gave us additional hiring authority. So in claims closed, initial claims processed, 44,000. Reconsideration claims process was 13,400. Continuing disability review claims process, nearly 10,000. Other claims process, 3,294, with a total of nearly 71,000 claims processed. Let's look at child support enforcement. They are designated to ensure that children are financially supported by parents who legally are obligated to pay child support. Their funding is a blended state and federal fund match. So 66% of the child support program is reimbursed by the federal government. And this is different from the disability program in that child support spends state dollars and they're reimbursed by the federal government. So it's not a direct relationship financially with the federal government. So that's the major difference between the two programs. So the child support program, the agency core functions include parent location, establishment of paternity, establishment, modification, and enforcement of child support and medical orders, collection and disbursement of child support payments. Non-judicial functions that we have we commonly call administrative functions, are obtaining financial institution information, DNA testing, obviously in paternity cases, in-hospital paternity establishment, where we work with hospitals to establish paternity, wage assignments, personal property and assets, liens and levies, tax refund, unemployment benefits offsetting, and lastly, license revocation. And we also, through judicial processes, through the county attorneys, do that local service delivery through the court system. Child support enforcement received approximately $46 million, including approximately $7.5 million in incentive monies based on federal fiscal year 2020. So the federal government runs a year behind so that they can audit the data in the following fiscal year. So these funds are granted annually, and they're federal funds counted in state fiscal year 21. Local service delivery, as I mentioned, through judicial processes are done through 113 contracts with county attorneys contracted statewide to provide local services. County attorneys have statutory first refusal rights to child support contracts. However, not all of them desire to have the contract and decline. This results in other county attorneys taking multiple county attorneys, resulting in all counties having coverage in all 120 counties. Child support has 651 full-time equivalents. That's a combination of state staff and county attorney staff in the child support program. Cost effectiveness ratio, the amount of child support collected to the dollar spent. This is based again on federal fiscal year 2020, is nearly $7 to 1. Federal fiscal year 21 disbursements, that was $385,881,235. Of that total, as you can see, the majority of which goes to families and children. Total disbursements was $250,708. And total disbursements to TANF to offset the dollars spent in the TANF program. This money goes back based on the FMAP rate to the federal government, and the child support program keeps the remaining amount of $38,360 $360,527. So let's take a look at the department as a whole. This is our org chart. From the left, and I know this is very small print and my eyesight isn't as good as it used to be, and I apologize for that. The Child Support Enforcement Program is on the far right and shows the different branches we have within that division. We have Lily Pattison with us today as well. She's the division director of that program. To the far right, you have the Division of Disability Determination Services. We have Heather Boggs here, the division director, provides operational support, as well as Joanne Wells. I had a senior moment there for a second, who is one of the assistant directors there that handles case processing. So, and in the middle, where our reorganization was focused, the highlighted area was the creation of the Division of Fiscal Management. So in our department, unlike other departments within the cabinet and state government, we did not have a dedicated financial division. So we had a little bit in child support and we had some in disability. So what we've done is combine all of that into one single division to create, let me go to the next slide, getting ahead of myself. So what does this do for us? It provides fiscal oversight for both department divisions in an independent way, provides increased oversight, financial fidelity, efficiency, and proper development and adherence to consistent cabinet-wide policies, and provides for cross-training and cross-assistance between branches, resulting in cost savings, preparedness, and staff attrition. So within this area, we have our budget person for the department. We also will, one of the priorities for this division is the bringing on staff for our program integrity section. Our two big ones we're going to be focused on. We have our fiscal facilities people as well in this division. Again, you know, both divisions' needs are different. In disability, the need is in Frankfurt and in Louisville, where we also have an office. In child support, it's statewide. It's through our state employees out there as well as our county attorneys. So those needs are much different. So putting them together made sense. We're hoping to have a new division director very soon. And so as soon as they're on board, we'll move forward in, you know, getting down in the weeds into hiring staff. Some staff were already in existence in disability and child support that have been, as the personnel folks say, crosswalked to this division. And this concludes my presentation. So thank you very much, and I'm here for questions.
Senator Alvarado.
Thank you, Mr. Chairman. I've got a lot of questions, Commissioner, and it's going to be somewhat critical of your leadership and how this organization, how things have been going. So I'm going to preface it with that. I think this is a department that could be split between the Attorney General's office and DCBS, frankly. I don't know that it needs to be where it's at currently. My first question is, what % of child support cases are currently and up to date in Kentucky right now? I mean, I think Secretary Friedlander had given us recent testimony in July. We were about 56, I think it was 56.35% of the total amount of current child support has been collected. So I'm curious if you know what, if that's accurate as to what that currently is.
Do you have that, Lily?
I have individual counties.
Yeah. That's roughly correct.
Does that mean also that approximately 44% of Kentucky's child support cases are not current in its collection?
That's correct.
Okay. What's the total amount of child support arrearages in Kentucky right now?
The total amount, do you have that, Lily? We have it.
So, Commissioner, I asked you that question when you came before this committee, or one of these committees before. I asked you that very question several months ago, and you said, I can get that for you, and here we are several months later. That's why I'm asking you again, hoping you'd be prepared knowing that I was on this committee. That should be off the tip of your tongue, I would imagine, if you're in charge of oversight of this.
Yeah. It is $1.4 billion.
$1.4 billion in arrearages for child support.
And as I said in that last committee meeting, those cases don't start with us generally. A lot of times families separate, they go their own ways, they get orders privately for child support. The non-custodial parent gets behind $20,000 plus, and then they come into our system. And those arrearages are added into our total arrearage.
Yeah, but I'm looking at your definition of who you are is to ensure that Kentucky's children are financially supported by both parents. $1.4 billion. We just had a meeting earlier with the Budget Committee about how many kids are currently under Medicaid. I can't imagine if 1.4 billion or even half of that was injected back into the system, how much less dependence would be on public support for those children if they were properly supported. Child support enforcement is implemented by county attorneys, as you mentioned, across the country. Clark County, I think, is number one. Our attorneys doing a tremendous job there. How does your department handle the political nature of managing the performance of locally elected officials across Kentucky?
The political nature?
How do you manage that?
Well, we fortunately, as you mentioned, our program has federal performance measures, and we rank counties by those measures. Paternity establishment, child support established, current child support collections, arrearage collections, and cost effectiveness. So we rank those counties by how well they do.
What's your assessment of Jefferson County's child support program, if you've got them ranked?
Jefferson County is ranked in the lower tier. They have some unique problems as a large urban county area, and they've had high turnover, like a lot of agencies and businesses in Jefferson County are having. We have worked with Jefferson County in the last few months closely to turn around their staffing shortage. They at one time had nearly 200 staff in their child support program, and they had dropped to 105 staff. And through no fault of theirs trying to hire, it just was difficult. So we've put more money in their contract this year, and they have had some success hiring. And we're working closely with them, meeting periodically, going over their hiring numbers, working on their performance measures, helping them train, and also, working with them and providing any direct assistance we can.
I think I've got my statistics show that there's more than 3,400 people in Jefferson County who owe at least $3,000 each in child support right now. There's more than $89 million in missing child support payments in Jefferson County alone, from my research. Does your department approve pay increases for county officials who administer your child support enforcement program?
Yes, sir.
What's your criteria for reviewing and awarding salary increases for a lot of these folks? Is there any connection with program performance as you just listed?
We look at their whether they have the money in their budget and look at the reasonableness of the raise. We presently do not tie it to the performance.
Yeah, that's a concern, and that may be why we're $1.4 billion in the hole on this. Have you approved salary increases for child support employees in Jefferson County since 2019?
No, we recently did in this most recent budget, the 2022 budget.
I'll give you an example of an individual.
Or 23, I'm sorry.
I think we've got the director of Jefferson County Child Support is Diane Fleming, was hired in 2017. Her initial salary was $66,019.20. Current salary was $120,000, and you also got another raise now at $130,000 $1,603.20. With numbers like this and bad performance like this, a doubling of that individual's salary. Are any of your executive staff family members related to the governor by any chance?
My chief of staff is.
Yeah, he's a cousin to the governor, correct?
He is the,
First cousin, I believe.
no, he's the second cousin.
Second cousin. Did he get what was he working in before he came to work for you as chief of staff?
He was doing our federal tax offset security.
Okay. And I also heard he had a big salary increase in that role as well. Are you also aware of, I think, of Auditor Harmon's 2019 report
Yes, sir.
on the Child Support Enforcement Program? I know the previous commissioner, when he got into office, noticed a lot of concerns and requested that audit to be done. I've got a copy of it here. It's pretty blistering. I know you've done a reorganization. I'm not sure if that's as a result of this audit and all the things that were mentioned in there, but that was all basically in stuff that was done under your leadership before. So sometimes when we look at reorganization, we start seeing that there's people that are related to other members of government, salaries that are doubled, people that don't do a good job in performing their jobs. That's a concern for me, that the structure we've got isn't working for that, Mr. Chairman. So I thank you for your indulgence, but I think a lot of times we need to start taking a look at having to restructure this and put it under different locations where this can be done well, because I think it can be run well. But in the meantime, we've got $1.4 billion backed up in arrearages for child support. A lot of those kids are on Medicaid. They're getting other kinds of government support because we're frankly not doing a good job. And again, that should be something that I would think would be off the tip of your tongue when I ask that question, to have to rely on staff. That's your main duty. That's what you said as to who you are here. Major concern, and I'm concerned that you're back in this position again, because I think we had a bad audit before, and we're back at it, and we're in this kind of situation. Thank you, Mr. Chairman.
Do we have any other members with questions? Senator Meredith.
It's a unique department and obviously has some challenges, but I'm curious, because of the political nature of this, working with county attorneys throughout the state, I guess most notably Jefferson County, since they seem to be the most deficient at this point. What kind of leverage do you have with those folks to do the job better?
Budgetary is for the most part. And on the political net, we don't look at politics. We just look at what the job is, the service delivery.
And I appreciate that, but as Senator Alvarado noted, over 60% of the outstanding child support payments from Jefferson County. I certainly note that they've had a shortage of staff, and you tried to address that. But if we're still not getting results from Jefferson County, what's the next step?
Well, my philosophy is to work closely with them, and that's what we're doing right now. We initiated a meeting to talk about hiring staff. That was the first thing to address. And so we're making progress there. We also are doing their training for the most part, and we have staff actually helping with some of the workload until they can get staffed up. So the next step is once they get staffed up, is to work with them closely on a performance improvement plan. So to ensure that they move upward in their performance of the program.
Well, these changes that you made, I think they'd be commended, but did they come as a result of your assessment of that particular county, or did the county attorney come to you and say, we're not doing a good job, here's what we need?
Well, I think it was a little bit of both. We interact with all the counties, including Jefferson County. We have team meetings with a select group of county attorneys monthly. And so we hear from them, know what their issues are, and hear from Jefferson County as well. That's why we heard regularly about their hiring challenges there and why they were struggling with their performance.
Well, if they don't improve, they don't address these arrears, will you point the finger at them, or they point the finger at you?
Well, I attempt not to point the finger of anyone.
Well, you have to. There's got to be some accountability for this, and
Oh,
that's what's
yeah.
missing so much from this. Is somebody's got to say enough is enough. And
Yes,
I
sir.
think particularly Jefferson County, enough is enough. Is who's going to accept the ultimate responsibility for getting this thing resolved?
That would be me.
Then what are you going to do if Jefferson County doesn't improve their situation?
Well, if they don't, we'll look at other options.
What are
Whether
those
they-
other options?
It could be, Jefferson County is a very large county.
I know it's a large
So-
county, but
so one
on
of
the
the-
micro level, it doesn't make any difference.
Right. The point I'm trying to make is that that would possibly be a private contractor looking at that, or, that's.
Well, how long will we go before we make that decision?
Well, I would like for them to have an opportunity now to get staffed up and then start proving their performance. So a year from now, we'll reevaluate that and see how they're doing.
Well, I think it goes back to the political nature of this relationship, and I don't see that it's not an indictment to use. Just you really don't have the leverage to make these people do what they're supposed to do unless you can interject some competition into this, and that's privatization of this possibly.
Yes,
So I think that's got to be looked at seriously. It's a lot of money. A lot of kids living in poverty that shouldn't be living in poverty. So is that something you have taken a hard look at, is privatization of this?
We have, not particularly Jefferson County, in the past, we have looked at privatizing. We've looked at some other states that do some privatization of counties, with mixed results. So that would be obviously contractors that would be available if we choose to go in that direction.
Well, contracts, you can fire them. It's hard to fire a county attorney, and that goes back to the political nature of this thing. And I don't blame you for that, but I can't blame you for the lack of results. What's the trigger point for any county where we say, you guys can't do it, we're going to give it to somebody else? What's the trigger point?
It's the lack of progress on their performance.
And how long do we give them on that?
Well, Jefferson County, a year.
Do we have any other counties in trouble?
We have rankings, so those in the bottom tier would be the ones that we watch.
Can we see those rankings?
Yes, they're public. We just we publicized that lastly. Let's see, in July. Yes,
Well,
July.
I'd like
So
to
we
see that.
can-
I'd appreciate it.
Yeah. Yes, sir.
The other trigger that I've seen in this program is really the waste, fraud, and abuse angle on it. When county attorneys, and we've seen several who've gotten into trouble and even been investigated by law enforcement, then those contracts go to other counties, and those are the times that I've seen the contracts move from one county to another, where a different county will oversee another county's child support enforcement. I think you have a couple of those examples currently.
Yes, sir.
Well, I guess I'm just a little bit too pragmatic for my own good, but I was thinking you had systems in place that when you reach a certain level, then you take action, and it looks like we don't. It's just kind of, let's wait and see if it's going to improve or not. And I think we need to have this more standardized, where if you hit this level, don't care, we're gonna move it out. And then that addresses the political issue that concerns me, particularly with county attorneys all being elected officials. I think that makes your job easier, quite truthfully. Thank you, Mr. Chair. That's all I have.
I've got a quick follow-up there, Commissioner. When ranking the counties, is there a threshold, like a certain percentage of collection that these counties are pushed to meet, or anything like that? I mean, or is it just whatever they can get?
We give them goals each year.
And is it different per county, or is there a specific percentage they need to hit each county, like 70% or whatever?
We have different thresholds for where a county lies in their performance. So the counties in the upper tier have a less percentage requirement to increase versus those at the lower tier.
What establishes those requirements? Or is it like economic factors in those areas, or what creates those requirements for each county to be different?
Just simply trying to meet what our federal goals are and the percentage of the performance measures.
Okay. And then one last question is, what states are privatizing their collections?
The one I comes to mind is Tennessee has a mixture. They contract with district attorneys versus some counties that are privatized. So with mixed results. Obviously, like in Tennessee, the contractors perform well initially because they kind of go after the easy reporting areas, the duplication of cases there may be. And so they generally, compared to a district attorney, have higher performance. But over a couple of years, after those cases have been worked, they end up being equal to, or sometimes the district attorney's office having a higher performance.
Okay, thank you. Representative Bentley.
Thank you, Mr. Chairman. On page 5, 66% of child support enforcement is federal. And we see here that most of this program is Social Security, under Social Security disability benefits. Just for a point of interest, does anybody get paid from Social Security?
Not in the child support program, no.
Do they give you guidelines since you're spending their money, sort of?
Social Security Administration?
Yeah.
Yes, sir. They have regulations, and they also assign, workloads, working closely with the Social Security Administration. It's actually well documented, and they follow our progress throughout the year.
So they evaluate you throughout the year too?
Yeah, the Social Security, the disability Social Security, that's the disability determinations. The unique nature there is that we're direct contractors to Social Security. As a matter of fact, what the classification of employees in DSS are FFTL employees as opposed to like regular state employees, and it really has to do with the nature that we're direct contractors with Social Security. So they set standards for us in terms of the number of cases we clear. They line us up against other states in the Southeast because that's where we are, is Region 4. I remember some of that stuff. And so we're ranked pretty well. We've had some challenges getting medical expertise, psychological expertise, right, just like any other side of healthcare. But I think we've got most folks in now. And so we perform well, particularly when you look at our sister states in the Southeast.
With $1.4 billion out there, would they ever say that we're going to decrease your funding because you can't collect that?
Well, Social Security would not. Now, the child support comes from
The child support is funded through the Agency for Children and Families, Office of Child Support Enforcement. So, no, they do not. Arrearage issues nationally is a major problem. It's not just in Kentucky. We don't want to minimize that. It's just the nature of how collections and arrearages come into our system. But they do provide for incentive monies. I think I mentioned in one of the slides, the incentive monies are based off our performance. And last year, we were paid $7.5 million in incentive monies based on our performance.
Thank you, Commissioner. Thank you, Mr. Chairman.
I think that's all the questions we have for now, but thank you all so much again for your presentation.
Okay, thank you, Mr. Chairman.
Mr. Secretary, you kept that seat warm the entire time, but now it's your turn, so you can go ahead with your office.
Okay, thank you. Can you help me move the Sorry. If I do it, it will break.
And we've got this room for about 30 more minutes, Secretary, so I may let you go for 15 or 20 minutes and stop and just ask questions on what you presented so far, and then we may end up having to bring you back next time.
I promise to go fast. So we call it GAPS, the General Administration Program. It's kind of the Secretary's office is the way to think of it. These are all the offices that are associated with the Secretary's office. I'll try to go through fairly quickly. Oh, look at me. You can see these different pieces. They're things that you know. HR, IT, our financial branch, Sarah Cooper over our Office of Legislative and Regulatory Affairs, Ombudsman, folks are often in touch with our Ombudsman program, our Public Affairs, so that's our communications group, Legal Services, you see all this, and probably the bigger one in terms of external impact is our Office of the Inspector General. Again, we are, like I say, the most of where our funding is, or the largest share, goes in the Inspector General's office. When you look at how our fund sources are split, we're mostly federal, but it's because of the way we do, and it goes back to my original testimony around cost allocation. So we cost allocate the costs of the Secretary's office across our federal programs. So we as I say, maximize what we can in terms of our federal reimbursement for our programs. Legal services, I think that's obvious, and they've been very busy. I think I'm the most sued secretary ever in the history of the cabinet. I continue to build on my record. Office of Public Affairs, again, this is communications, but that's internal and external. Susan Dunlap leads that. I'm sorry, Wes Duke leads the Office of Legal Affairs. Susan has an expertise in internal communication, and I've tried to be really intentional about that. So I have a podcast, but it's really targeted internal so that folks can get to know other people in the cabinet. I try to do across departments, and then I do some videos. I hate looking at them. Those are all the kinds of things that we do, and about 80 million, well, they said 285, but I mean, we get media inquiries all the time. Ombudsman, this is really an interesting program, and I'll try to do this fast. Administrative hearings is there. So all of those 13B hearings that folks have to go through when they go through our processes, and like they SNAP disqualifications or any of our programs where they maybe weren't eligible for something or get kicked out of a program, they go through the Office of Administrative Hearings. Occasionally a licensure hearing will come through here. Certificate of need hearings come through here. So it's a pretty big group of folks. And so that was added most recently to the Ombudsman's office, because a lot of that then is you're dealing with the public and you're dealing with providers and you're dealing with individuals. So that's a big piece of it. Then the citizens who call in, that's, again, it can come from the General Assembly. We funnel everything through our Ombudsman's office because they have a nice tracking system, so we can follow through. It's like canary in the coal mine a little bit. When we start seeing complaints go up in a specific area, it kind of lets us know what's happening. And then the program performance is the group that really overlooks kind of DCBS. It's an independent look at DCBS. It'll review cases, it'll review timeliness of cases, and they usually have an annual report for you all about what their review of DCBS is. A lot of folks then come out of DCBS and go into this, so it helps with quality control, and it's a pretty big job. The Ombudsman is Lisa Lee Williams. So we have two Lisa Lees, but Lisa Lee Williams is the Ombudsman here. Administrative Services, Astrid Masterson. This is facilities management, accounting, procurement, contracts. Senator Meredith, you are probably on a first name basis with Astrid. And so this is everything. This is like small but mighty, because they handle everything on the procurement and contracting side for the Cabinet for Health and Family Services. They also work, they have facilities, so they're not finances facilities, right? But we have folks who help us with our facilities. I invite you all over to the Cabinet for Health and Family Services anytime, specifically, I think when we get to the point where we're redoing our escalators. I want you all to be there and feel sorry for me. Our application technology services, that is then these are the folks that help us with our eligibility systems. It really is kind of our IT folks, our IT maintenance. They're not COT, but they do all our IT projects. So give an example. So all of the eligibility systems, all of the Connect stuff. If you saw lots of things on how we back up our data and present it to the public, this is the group that does a lot of that. It's heavily contractors, attracting state employees for the salaries that we can give is a challenge. So this is a heavy contractor group, this office. Jennifer Hart is the person who's in charge of this. Office of Data Analytics. This was one of the things that was changed in the reorganization that you all passed. This was called the Office of Health Data Analytics, but really what we were looking at, and we brought it in more tight to the Secretary's office. So that group is one that we're continuing to evolve. When I came into the Cabinet, OATS, there was something called OATS, and it had both this function and the IT function. The previous administration split it, Office of Health Data Analytics and the IT function. When I came in, I was sold. Great idea. We need to have data analytics and health data analytics. We should be looking at our data. We should be using our data. But how it ended up functioning was there wasn't good definition between what one group did and what the other group did. So this is helping us make that definition. So, you know, I wish I could give a better. So here's an example. Somebody wants to query our eligibility systems. If it was just a simple query, they'd go to the technology side and get it pretty fast. If it was like how do two systems work together, they were going through data analytics, but if they felt like they could get it quicker some other way, they'd go another way. So we've really been working on how to structure this. It's still a work in progress, but it's something that we are working on. And this is the group that works with the universities. So there's called the State University Partnership. It's where Medicaid helps fund some research on the part of universities. Again, this was started previous administration, great idea. And so we work with the universities on what they're called their state university projects. They're their research projects. What I've started to try to do is, it was always the universities would propose to us, and now this year, for the first time, about 6 months ago, we came up with a list of, hey, help us study some things. So it's a back and forth. We're still right in the middle of the process. I can't tell you if it's been a success yet or not, because we haven't even had our first project yet. So we're still working through that process. Finance and budget, you've seen Eric Lowry sitting next to me. He is the one that really helps set up how we fund the Secretary's office. I called him a genius before, and his staff have not stopped giving him grief because of that. But I didn't say if it was a G or a J. But he's you know, it's an $18 billion budget. You've got to have some pretty strong skills to be able to handle that piece. Office of Legislative and Regulatory Affairs, Sarah Cooper is acting there for us. And those are the folks you deal with, right? That's who you deal with when with legislative questions, it comes to this group, and that's who normally answers your questions and shepherds or would send these PowerPoints to you all. That comes through our Office of Legislative and Regulatory Affairs. They also handle regulations. And so it's also, if you're on the Regs Committee, you see them all the time. And somehow they keep us straight in presentations to you all. HR, we just had a retirement, Teresa Straw. Michelle Barnes is over HR. Again, this is everything. This is every employee in the cabinet, and I always like to say, it is, you never know what you're going to get from one day to the next. Personnel is always probably HR is probably one of the more challenging things within any organization. And then the Office of Inspector General, I think you all know them well. They're the folks that do the surveying of all healthcare, childcare. Some of what's going on in assisted living is as Commissioner Elridge presented, we are, based on legislation, working out where that line is between assisted living health and assisted living social, and we're trying to work with organizations on that. And they also have the CARE system, which is a fingerprint system. It's a really good system. It will tell you if then somebody has subsequently been arrested. Also, Casper is there in the Inspector General's office, as well as Certificate of Need sits there now. So it's got a lot of different pieces. We also, under the reorganization, moved our Kentucky Health Information Exchange. KHI is also now under the Inspector General's office. Moved it there because they had Casper, and so it made sense to me to kind of align those programs. How is that?
That's pretty good. You know, I wear several different hats, and one of those is an auctioneer, and you probably give me my run for my money there. I got a couple of questions for you, Mr. Secretary. You had that slide just a second ago on your Human Resources Department. How does that differ from the personnel cabinets?
Okay. Like the facilities group, it relates, our facilities groups relates to finance facilities group. Our HR office relates to personnel cabinet. So there's so many actions within the Cabinet for Health and Family Services. We have a group that helps coordinate that in collaboration with the personnel cabinet. Disciplinary actions, hiring actions. Those are things that we work together with the personnel cabinet on, but it's important for us to have a group dedicated within the cabinet because we have about 6,000 employees, and that would just, I think, it's important for us to have this group, and they relate to the personnel cabinet, but they perform some of the functions to get folks ready for hiring and all those kinds of things. Just like I say, disciplinary action and all sorts of things. Payroll processing, right? We do that. Those are the sorts of things that our HR group does.
The reason I ask that is because I know that hiring state employees can be it's cumbersome sometimes. Yes. With the regs and the rules that we have, especially with the merit system. So is that hindering your hiring ability in any way, especially having those two entities, the personnel cabinet plus your human resources? Because I understand right now we're hiring some temporary social workers and things like that. We're hiring them under the state while they apply to become state workers. So is there a hindrance there, and what can be done to help that situation if there is?
I think that's a good question. We've had to really re-examine our processes within the cabinet, because then each individual department, like DCBS, has folks who are responsible for helping them move through the process. And then it's the same thing at our level. So it's how do we make sure that we are as efficient as possible within that structure. I think we've made some improvements. As you mentioned, we do some temporary hiring to make sure we can bring people on more quickly than really some of the regular state hiring process. I think the things we ask for, like background checks, making sure that we're vetting, is somebody qualified for a position. We're just those kinds of communications. I think we're working on streamlining. Can always improve processes. I think that's a fair thing to say, and we've worked really hard within the cabinet to make sure we streamline as much as possible.
My next question is going to be about the Office of Legislative and Regulatory Affairs. What role do they play in implementation?
Good question. So they do play some role in implementation. I have asked the former director there to really focus strictly on implementation within the cabinet, and because I felt like we needed somebody, one person who was devoted exclusively to that, because there's budget implementation, there's legislative implementation, and making sure we have the regs right. So we're still working out some of the division there, but regulatory affairs follows it, flags it for us, here's legislation that we need, and then make sure that those pieces that need to be implemented get implemented.
And I understand that that's good information. We've seen in the past, not just this administration, but administrations in the past, where it's taken years to get legislation implemented that the General Assembly has passed. And if you've heard me over the past couple meetings, this is one of my pet peeves, I guess you'd say, is that implementation doesn't always follow, especially as quickly as we have intended in the past. We've got examples out there right now that have not been implemented, and that's concerning. I've heard the governor a couple of times say that we don't have to implement it because they didn't put the money in the budget. But there's been times in the past the money has not been put in the budget, and it usually when that happens, it is the intent of the General Assembly that it comes out of the current budget that is there. We don't always have to earmark money and put it forward for it to be implemented. And that's going to be our opinion. That's how we operate, and that's how we continue to operate going forward. So I would hope that the governor would go ahead and implement the laws that this General Assembly has passed with our intent. And a lot of times as we speak of intent, we hear that a lot of times folks saying, well, what was the legislature's intent? But, I've never had anybody ever come and ask us what our intent was when they're trying to implement these things. So I would just add that as kind of a side note there. And then my final question is switching gears a little bit to the Office of Ombudsman. I don't think you had this in there, but complaints, this is where complaints come, right?
Yes.
So if it's a complaint with a service, a Medicaid service, or what I know best, foster care and adoption, it comes to the ombudsman. So the ombudsman, do they see people from the general public?
It's usually by phone. So in terms of one-on-one meeting somebody in the public, that is not necessarily their role. It's more electronic communication.
Okay. The reason I asked that,
Yeah.
we received an email. The content of the email is not pertinent to this committee. But there was one thing that I pulled out of that. It said the Office of Ombudsman does not see people. For me, in just my thinking, it's a little concerning because the Office of Ombudsman is where the general public should be able to go to talk about their issues, the issues they have with the cabinet or a department or whatever it may be. Who do they get to go to? I mean, who can they sit down face to face with and talk about their issues? I mean, how can the ombudsman draw an honest conclusion by not sitting down and looking somebody in the eye? My concern is their availability to the public. And the reason I say that is because I've said this for years. The Office of Ombudsman and the Office of Inspector General, I believe, should be outside of that cabinet. And it's not because of you or it's just, it doesn't matter who the secretary is, what party's in charge, and who the governor is at the time. There has to be some accountability there, and I believe that having them under the secretary and in the cabinet is kind of like the fox guard in the hen house. And so that's my concern and my issue there with the Ombudsman Office and the Office of Inspector General all being housed in the cabinet and under the secretary is, like I said, nothing towards you at all. This is just for transparency in general, no matter who's in charge.
And you're right. The Office of the Ombudsman is really, in my memory, never seen folks face to face. It's always been more, if they ever have, it's really rare. It's really rare.
That's all I have. Senator Alvarado.
Thank you, Mr. Chairman. Office for Children with Special Health Care Needs. I thought that was part of Am I wrong? Either I'd seen an organizational chart or something before where that was under the Secretary's office or not, or if it's not affiliated there.
It's not affiliated there. They're independent.
Okay.
I used to be over them too.
Okay. I thought I had seen a previous organizational chart where that was affiliated or not. That's why I thought maybe in July when we had gotten that, and maybe my memory doesn't serve me correctly. That's why I was asking if.
I don't. Well, look.
That's why
I don't.
have it
I don't
today.
think so because they're funded by Title V.
Okay.
So they're more closely. They have been actually under public health before, and then independent. So they're more aligned as a separate office, and they like I say, they're more closely aligned with public health.
Okay. That's what my questions were going to go to that effectively to say, can we hire? I think University of Kentucky's offered. I know when I was in training, that's who did a lot of the clinics for that, but wasn't sure if that's a contracted thing or if that's part of your office or not. But if it isn't, then maybe it's something I need to ask. And the thought was to maybe look at having them be aligned with public health as well. That was I noticed that in your presentation it wasn't there, and I thought, well, I wonder if that was part of it. But maybe I'm thinking of something in the past.
They mostly, and I'm sure Ivy Alexander is the person who's over that.
Mm-hmm.
They mostly contract through universities for a lot of what they do.
Yeah.
There are some pieces that they go to private physicians and contract with individuals. You're not asking about the office. Sorry.
No, but they're
Yeah.
independent. They're independent currently.
Yeah.
That's what you're saying. Okay, they're a separate entity. Thank you. That's all, Mr. Chairman.
Do we have any further questions from the committee? Seeing none, thank you, Mr. Secretary. We appreciate your time as always. Let's see, our next meeting will be October the 19th at 3 o'clock. We'll be in this room. Is there any further business to come before the committee? If not, is there a motion to adjourn? Second, and without objection, we are adjourned.